Hello and welcome to Triage, rapid legal lessons for busy healthcare professionals, a podcast created and produced by K&L Gates. Each episode is designed to highlight important developments in health law and analyze the impact on our clients and friends of the firm. We hope you enjoy this podcast.
Hello and welcome to this COVID-19 episode of Triage. My name is Richard Church, and I'm an attorney in the firm's Research Triangle Park and Chicago offices. My practice focuses on healthcare regulatory and transactional matters, and we spend a tremendous amount of our time focused on 340B drug pricing program and pharmacy-related issues for our institutional healthcare clients.
And I'm Victoria Hamscho. I'm in the firm's Washington, D.C. office, where my practice focuses on healthcare policy and regulatory matters. In this episode of Triage, we will provide an update on recent developments in the 340B program, and in particular, on recent COVID-19 guidance by the Health Resources and Services Administration, or HRSA, and hospital requests for additional flexibilities to help them respond to the pandemic, particularly as it relates to eligibility requirements under the 340B program. By way of background, HRSA recently issued guidance regarding 340B program requirements in light of the evolving impact of COVID-19. The guidance touches on several issues covered entities are currently grappling with, which include issues relating to the patient definition and GPO limitations under Section 340B, as well as the use of telehealth services and registration of temporary sites. While emphasizing the importance of taking into account the realities of the COVID-19 pandemic in assessing covered entity compliance with 340B program requirements, HRSA's guidance provides little implementation instruction for covered entities. HRSA generally recommends that covered entities consider their emergency responses in light of 340B program requirements, ensuring that their handling of 340B program matters related to COVID-19 is incorporated into their policies and procedures in regards to 340B, and that they establish a process to maintain some form of records to demonstrate compliance with 340B program requirements. Importantly, at the time, HRSA asserted in the guidance its view that it is unable to waive 340B statutory requirements in helping covered entities respond to the COVID-19 pandemic. Although HRSA addressed the matter in the context of issues relating to the patient definition and GPO limitations, this view could have important implications for covered entities in regard to other statutory requirements, particularly hospital eligibility requirements.
As many regular listeners of Triage are aware, in order to participate in the 340B program, disproportionate share hospitals, freestanding children's and cancer hospitals, sole community hospitals, and so-called rural referral center hospitals all must demonstrate a minimum disproportionate share hospital or DSH percentage on their most recently filed Medicare cost report. These standards are at 8% or 11.75%. And if a hospital's percentage falls below the minimum, they can no longer participate in the 340B program. As 340B hospitals have been responding to the COVID-19 pandemic and are looking at the long-term financial impacts of the crisis, one area they should be assessing is how changes in admissions and payer mix related to responding to an influx of COVID-19 patients could affect their long-term 340B eligibility. The DSH percentage is a product of Medicaid inpatient days and Medicare SSI or supplemental security income inpatient days. And hospitals increasing their bed capacity to accommodate an influx of patients could see changes in these numbers, particularly as their non-Medicaid and non-Medicare SSI patients could cause these numbers to shift dramatically lower and result in them losing 340B program eligibility. As a result, 340B hospitals have been advocating for HRSA to waive the DSH adjustment percentage requirements for the duration of the COVID-19 public health emergency, and particularly then extending beyond that through the next cost reporting or multiple cost reporting periods that may be impacted by responding to COVID-19. In this regard, 340B Health, the American Hospital Association, America's Essential Hospitals, and the American Society of Health System Pharmacists have all requested that HHS Secretary Alex Azar waive this requirement.
340B hospitals have also been urging policymakers to address the issue as part of the congressional response to the coronavirus. Last month, Senator Ben Sasse from Nebraska tried to incorporate an amendment to the Coronavirus Aid, Relief, and Economic Security, or CARES Act, the $2 trillion coronavirus relief package that was recently enacted by Congress. The amendment would have paused hospital eligibility requirements under the 340B program for the duration of the pandemic. While the amendment was not ultimately incorporated as part of the CARES Act, given in part the urgency with which the bill was passed. 340B hospitals continue to work with Congress on a potential statutory fix. Congressional leaders are currently weighing proposals for a potential fourth coronavirus relief package, which is commonly referred to as Phase 4. The package is expected to cover issues that were not sufficiently addressed in the CARES Act, which could include relief and flexibilities for healthcare providers, which could serve as a vehicle for a 340B statutory fix.
In this regard, Senator Sass announced this week that he intends to reintroduce the 340B amendment language as part of the Relief for Rural Providers During Emergencies Act, which he will try to incorporate into the next coronavirus relief package.
Timing for consideration of a Phase 4 package is unclear. House Speaker Nancy Pelosi indicated last weekend that she hopes to move quickly and bring the next relief package to the floor this month. Although Senate Majority Leader Mitch McConnell has voiced his preference for waiting until Congress can assess the implementation of the CARES Act before they move to the next relief package, there is an increased sense of urgency to act to provide relief to various stakeholders impacted by COVID-19.
As should be clear, most hospitals, health systems, and academic medical centers are broadly considering right now how to manage the financial impact of responding to the pandemic. Multiple federal agencies and the Congress have been rapidly releasing a variety of programs to shore up hospital cash flow as their non-elective operations have been shuttered and resources and funds have been redeployed to COVID-19 triage and treatment settings. These programs include FEMA funding, direct funding to healthcare providers through the CARES Act, the details of which are still forthcoming, accelerated payments from CMS through Medicare administrative contractors, and others. As hospitals assess this financial landscape that they face in the weeks to come, addressing the potential impact of a loss of 340B status upon filing their first cost report after the start of the COVID-19 crisis should also be assessed. In this regard, 340B hospitals will likely want to continue to work with Congress and the administration on some sort of temporary waiver of eligibility requirements under the 340B program, particularly if their current DSH percentages are within close range of the existing 8% or 11.75% criteria. In this regard, the Department of Health and Human Services has granted extraordinary flexibilities to assist healthcare providers responding to COVID-19. Both HHS and HRSA recognize the impact of COVID-19 is having on the operations of healthcare providers. And HRSA itself noted in its first initial guidance that it is unable to waive statutory requirements at this time, but it will continue to monitor and address the pandemic. We will continue to monitor these developments. Our healthcare and FDA practice and policy groups regularly advise 340B hospitals on similar 340B compliance matters, eligibility matters, and facilitate stakeholder engagement with Congress and the administration, and can continue to assist in this regard. Thank you again for listening to this episode of Triage on HRSA's COVID-19 guidance and hospitals' request for additional flexibility. Please do not hesitate to contact us if you have any questions. Be well and be safe.
Thanks again for listening to Triage, rapid legal lessons for busy healthcare professionals. New episodes are available for download through iTunes, Google Play, and other podcast applications. By subscribing to Triage, you will receive timely notifications of each new episode. Also, if you have any topics that you would like to hear discussed on Triage, please don't hesitate to email triagesupport@klgates.com. We would love to hear from you.